Thanks, Mr. Chairman. Thank you, Ms. Tavenner, for being here today. And the chairman is describing the fundamental difference of opinion that we've had for about 4 years here, because the value system that he likes, I believe, is a value system that transforms our healthcare delivery system in the wrong direction by expanding a system that we already knew cost too much. And the result is increasing premiums for millions, canceling insurance plans for millions, destroying relationships with doctors for millions, raising taxes by $1 trillion, forcing people into Medicaid, spending $500 billion Medicare dollars on new programs instead of investing in Medicare to make it more solvent, and encouraging employers to have their employees work 30 hours instead of 40. That's not the value system that I support. And we have a different approach, which would say, let's encourage competition, let's encourage choices, and let's try to make health care cheaper so people can actually afford it. But that's our fundamental difference. But may I ask you, Ms. Tavenner, don't you know now, with the improvements in the website, how many people are trying to sign up every day for Obamacare, how many are succeeding, what their level of insurance that they're buying is, what zip code they live in? Don't you actually know that now?
That's the information, Senator Alexander, that we are putting together and we will have available next week.
Oh, next week?
Yes,
mid-November,
and that's what I'd said all along.
You're going to release it once? I mean, why don't you release it daily?
So we had said all along, long before the program went live, that we would do monthly data very similar to how we do Medicaid, how we do Medicare.
But this is a little different. This is people who are making decisions, people who are going to lose their insurance starting January 1, people who have to sign up by December 15.
And I would say that's all the more reason to do it monthly, because the fact is this is early on and people can decide to go in and out and they don't have to make payments till December.
But the people who need to know about it are members of Congress who've appropriated $400 million. Let's say I'm a governor in one of the states that hasn't decided whether to expand Medicaid. I'd like to know whether 90% of the people who've signed up are going on Medicaid, or whether it's 80 or whether it's 70. You know, and if we can know how many hamburgers and cars and records are being sold every day, why can't we know how many people are enrolling in Obamacare? If it's such a success, wouldn't that promote the success of the program, build confidence in it?
And we'll have that information next week.
But that's once. I mean, why don't we know it every day? I mean, you know it now, right?
We are in the process of putting together that information.
But we're the United States Congress elected to represent the people, and we're entitled to know answers to these questions so we can make our judgments about what to do. So are governors, and so are the consumers across America.
I understand.
And as far as the example I used of Emily from Tennessee, from Cover Tennessee, isn't it true that the Cover Tennessee program was simply canceled by Obamacare? I mean, it's a case of Washington saying that insurance isn't good enough for you, so you can't buy it anymore.
First of all, I don't think it was canceled by Obamacare. I think the insurance company made a decision to cancel a policy and offer something else.
Well, now here's a letter from the state of Tennessee, which has now disappeared, which is I pushed the wrong thing, but I know what it says. It's a letter from the state. It's a letter from the state that says, Cover Tennessee won't be available starting January 1. This affects all Cover 10 members. The new federal health care law will bring many changes, including new health insurance coverage options for Tennessee. The Obamacare said if the law had maximum limits, that if you didn't meet the standard for maximum limits, you couldn't offer that insurance anymore. That's the law. So in this case, for these 16,000 Tennesseans, Obamacare said that insurance isn't good enough for you, and so Emily can't buy it anymore, and she has to pay $6,000 more. Isn't that true?
I think we've been down this issue before. They could have been grandfathered in. They could have kept their...
No, ma'am. No, the law says that if the state program doesn't meet the maximum limits, it's outlawed. Does the law not say that?
For new plans, I'd have to look at...
No, for the old plan. For the old
there
plan.
was an opportunity for old plans to be grandfathered in.
Ms. Tavenner,
going around on this.
there are provisions in the law passed in 2010 that say if a plan doesn't meet the maximum limits, the plan can't be offered. Tennessee
So
employers.
you're talking about lifetime limits and this sort of thing.
That's correct.
I'll be glad to get you that
So,
information.
so the fact is, Obamacare outlawed that plan, and millions of Americans are having their plans canceled. Why don't we put the president's words into law and say, if you like your plan, you can keep it and end the debate? My time's up. Thank you, Mr. Chairman.